Thank you so much, Julie, and welcome to all of you. After I left practice full time back in 2010, I started working with individual practices to help them connect better with you, the pet owner. So, as part of my work, I get to visit practices all over America and I get to watch their workflow. And I begin by sitting with you guys in the lobby and meeting your dogs and cats and just having a conversation with you guys. And I have to tell you that it is such an enjoyable experience for me to do that. And I haven't been able to do that almost at all since the pandemic began. So even though I'm not able to sit next to you and talk to you and meet your pet, which I love, I'm glad that we're doing this. I want to thank CC Health for making today's lecture happen and for being so supportive of great veterinary education for you and for veterinary professionals. I wanted to remind you that there are some resources for today's lecture. So you're going to see a couple QR codes pop up like this. And if you have a QR code scanner on your cell phone, you'll just be able to scan those codes and that website will come up. So we've done a videotape for each of the parts of the exam that I'm going to explain today have been videotaped by a veterinarian. And it's about 1.5 to 2 minutes each one. So the same thing that I'm going to go through today. If you want to see the veterinarian actually do that part of the exam and talk you through it, then just go to when the QR code comes up, here it is. That will take you to the website and you can have that on hand on your phone so that you can look at it later, or just go to the website animalmedicalnc.com. So this is me and my beloved pet Rye. Unfortunately, I lost Rye last July. You know, Rye was more than a pet. Rye was my partner. So I'm here in New York City now, but I have a farm in northeastern Pennsylvania. Rye got to go between two places, but I can tell you she loved the farm much more than she did New York City because she got to run off lead there. And I'm telling you, that dog just lived life to the fullest. I miss her so much. So over the years, she had various ailments, that occurred. She lived for 12 years. On the farm when she got to run off lead a lot. And I remember one of the first couple of trips we took up there after we purchased it, I hear her, she was just a German short hair pointer. She was just freaking full of energy. Couldn't stop her. She's just driven. And one time we're in the barn and I hear her padding around, like sniffing for everything, right? And she's so happy, and I hear her stepping and it's like step, squish, step. I'm like, what is that squish sound? And I look, she had caught her paw and she is bleeding profusely all over the floor. And I'm like, what? And it's Labor Day weekend and there's no one to call. So I'm like, will you stop moving around? I mean, she's acting like nothing is wrong. So I put her leash on and I stick the leash, shut the one end of the leash in my car door so that she can lay in the shade and hopefully clot. And while I figure out what I'm going to do with this dog. And so I'm on the phone, trying to figure out a vet in the area that's open. We're in the middle of nowhere to go to. And I come back out and look, and the dog's gone. All I see is this blood that's smeared on the side of the truck. I'm like, it looked like there was a car accident. I'm like, what? The dog had decided that she didn't want to clot out on the lawn. She decided that she was going to claw her way up beside the truck, jump through the window, and she was happily sitting on my driver's seat, bleeding out all over the chair. So that was Rye. So she had, over her lifetime, lacerations, she had skin issues, she had lumps and bumps, she had dental disease, anal gland issues, and then finally, the last thing was mast cell cancer. But her vet is great friends of mine. He's the one who did the video, and he lives 2 hours away. So there were many times when I had to use my own training as a vet tech to decide, okay, this thing that I'm seeing on my dog, is this a now visit? Is this an emergency visit? Or is this something that I can put off for a little bit? Or does it not need veterinary attention at all? And that was very helpful. And when the vet and I were talking recently, we thought this would be a great thing for us to teach pet owners, because you guys, nobody knows your pet better than you do. And when you're in your home, your pet is happy to be with you, and you're going to get the most accurate reading of what your pet's normal baseline is when your pet's at home. So, you can bring your pet to us and we can get a temperature or respiration or a heart rate, But when your pet comes to us, there's probably always some excitement or maybe even a little anxiety on board, and that's likely to mask signs of illness, and it's likely to elevate those typical baseline readings that we get on your pet, like respiration rate, like heart rate, like temperature. So it's wonderful if you guys can keep track of this stuff at home and know what to look for. Then your veterinary professional and you can partner to provide your pet a lifetime of great care, and also be on the lookout for disease at its earliest stages when it's most treatable and most affordable to treat and less invasive to treat. So with that end, what we're going to cover today is I'm going to cover the 3 signs, major signs of pet health, and then I'm going to get into how to examine your pet at home. And this lecture is information packed, so you'll forgive me. I'm going to speed along. If you've got any questions, we'll have a question and answer period at the end, or just reach out to Assisi Health with your questions and they'll forward them to me, or they'll find an answer for you. So here are the 3 major signs of good health. The first is attitude. So get in the habit of knowing how your pet behaves when you arrive or if you leave for work. And there shouldn't be any acute changes to that or progressive changes to that. So when you come home, your cat runs up to the door, your dog runs up to the door, and suddenly that stops happening, or that progressively stops happening, that's worth further investigation. If you open that bag of food or open that can and that cat that you haven't seen for days comes flying down to get that food, and then suddenly that stops or progressively stops, that could be a sign that something is up and you should pay closer attention to it, or get your veterinarian involved. The next thing is coat. The skin is your pet's biggest organ. That fur is coming right out of it, and the fur is going to be an excellent indicator of what's going on minimally with the skin, and on a greater scale, what may be happening systemically with your pet. So coats should have a luster to them. They should be kempt and clean. Even if your pet has long hair, you shouldn't automatically expect it to have mats in the fur. That's not normal. If your pet is matting in the back when it didn't mat before, that could be a mobility issue. Sometimes cats especially will start, as they age, start to develop sort of a greasy look to their fur. Typically, this is a sign of diabetes, because the pets are, they're so diabetic, they have so much sugar in their body that it's actually in their saliva. So when they're licking their fur, they're depositing the sugar coat on their fur, and that's what's giving it that greasy look. Hair loss, hair patches, all of that's abnormal and is definitely worth closer inspection upon you, or get a vet involved. And then the last thing is mobility. So if your pet is used to jumping up on the bed or running up and down the stairs, and suddenly you see hesitancy there, or you see changes in that I would keep my eye out for that. Sometimes you'll see pets, as they anticipate jumping, you'll see them do this. Well, it can be like, I'm getting my mark, get ready, get set, go. But it also can be, I'm preparing myself because this is going to hurt when I do it. And you want to take care. Pet owners often believe that arthritis is just to be expected in pets. But arthritis is a negative feedback cycle. What happens with arthritis and any kind of joint injury is you get inflammation, and inflammation is part of an immune response, which is going to attack tissues surrounding that joint, which will cause more inflammation, which will cause more deterioration of the tissue. So it's a progressive disease, and it can be treated simply with anti-inflammatories that your veterinarian can offer you. These are affordable and will keep your pet mobile and feeling better, and stop the progression. It will decrease the acceleration of that progression of mobility. So let's talk about the exam. I'm going to teach you to examine your pet from the tip of his or her nose to the tip of the tail, just the way that we do at a veterinary practice. And we're going to start at the mouth. So you can lift up the side of your pet's mouth, whether it's a dog or cat, and we'll take a look at that gum line. Those gums should be coral colored. If you run your finger over them, they should feel slippery and moist. They shouldn't feel tacky or appear pale. When you press on the gum and then release it, it will momentarily blanch, and then it should automatically refill with blood again. So we call this the capillary refill time, or the CRT, and the time that it takes for that flesh from its blanched appearance to return to that coral, flushed, perfused look should be 2 seconds or less. If you have pale gums or a capillary refill time that is less than 2 seconds, that's a vet visit. Make sure that there is no excess calculus or tartar on the teeth. Make sure there is no reddening around the gums, and it is not normal for your pet's breath to smell bad. That's not a normal part of aging. We're going to talk more about dental disease at the end of the program. Next, we're going to move on to ears. So ears too, depending upon the color of your pet's skin. So some labs or pit bulls or cats, for example, won't have a coral color. Cats will sometimes have just a pale color in their ears. And some of those, like a lab or Rottweiler, may actually have black ears. So you're not going to be able to see this. But for those, the remaining pets have a kind of coral color. You should be able to see a capillary refill time in those two. So press it, it'll turn white, and then it will perfuse again. They shouldn't be excessively hot. There should be no strong odor coming from them. There should be no excessive debris or wax. They shouldn't be pawing at the air. They shouldn't be shaking their head a lot. That's a sign something's going on in there. And they should have a supple feeling. If you feel the base of the ear, it shouldn't feel crackly or hard, which would be indicative of a pet that has had a history of ear infections and on and off again inflammation. I want to show you what the anatomy of the ear looks like. So the ear goes down in an L shape like this. So I tell you this because that bend, especially in that ear, is the perfect spot to get infection in. In an ear, it's filled with hair and it's dark and it's moist and bacteria just love it. So if you're looking in your pet's ear and you're seeing redness at this particular section, it's very likely that it's even worse down in that section where you can't see. So that's why when we look at it from the vet's perspective, we're sticking that otoscope in there, and it's getting all the way down into that canal, that bottom part of the L, where we can see a little bit better. Try to get that debris and dirt out of your pet's ears. Don't take the ear cleaner and go squish in that ear. That your pet's gonna hate that. I hate when I see people, veterinary professionals sometimes do it, makes me nuts. It's uncomfortable for your pet. Get a cotton ball and load that thing up with solution. It's gotta be sopping wet. Stick it in the ear, fold the ear over, and massage that in. And massage it for a good 30 seconds to 45 seconds to allow that solution to come up to body temperature. If it's a little bit warmer, it'll be better at removing some of that wax and debris, and then just scoop that out and keep scooping it out with a cotton ball until you get all of that debris out of there. You can clean your pet's ears as needed, depending upon what you're seeing in there. Next, we're going to move on to the eyes, and we're going to talk about 5 areas of the eyes very quickly. We're going to talk about the cornea, the pupil, the iris and lens, and finally, the whites of the eye. So make sure that when you're looking at the eye head on, that both globes should be symmetrical in size. You could run your fingers over the top of your pet's closed eyes, and it should feel the same on either side. The whites should not be what we call injected, meaning they shouldn't be bloodshot. That's not normal. That could be a sign of irritation or an infection. The cornea should be clear. That's the covering over the eye. So when you're looking in your pet's eyes, that top part that looks like it's kind of covered with glass, it should be reflective and shiny. You shouldn't see your pet winking or blinking or a droopy eye, which may mean that cornea is scratched, which would be very painful. That's why your pet is blinking and needs to be seen by a vet. The pupils should be symmetrical, and they should be equally responsive to light, so that when we brighten the light, they narrow, and when we decrease the light, they open up at the same rate. And your pets should have a positive menace response. So a menace response would be we cover one of your pet's eyes, and then with the other hand, we go like this at your pet. Because your pet can see that, it thinks you're going to poke it in the eye, and it should blink. That this is the menace. And so a positive response would be it blinks according to that would be a sign that your pet is sighted in that eye, and you could do that in either eye. I put this up because we've often seen our dogs or cats' eyes light up at night. And this is due to a layer of cells that cover the back of the retina, and this is called the tapetum. And the tapetum is responsible for reflecting reflecting light back in to the posterior eye chamber and helping amplify that light so that our retina can more accurately pick up on those photons and helps them see at night. You may also, if you're looking into your pet's eyes, and this happens with old dogs, it happens with old humans, when you look into old, you might be able to see it in mine, with old people's eyes, they get a little blue. And the reason is because the lens with age starts to stiffen and it refracts light a little bit better. So dogs and cats, like people, don't see as well when we get older, but they don't need reading glasses. They're not, you know, doing the New York crossword in dim light. They're fine with whatever they're able to see with those aged eyes and their sense of smell, which is much more important to them. This is not cataracts, but still, if you're concerned, if you're seeing any changes in the eye, you know, your pet's only got 2 of them. So that would be a now visit for the vet. By the way, this condition is called lenticular sclerosis. So let's talk about the lymph nodes. It's too bad in our world that we don't have better education about the lymph system, because it's fascinating. You know, your blood pumps through the arteries and then it goes down into the arterioles and then it gets into the capillaries. But some of the blood oozes out from the capillaries. It seeps out from the capillaries and it perfuses the tissue and the cells around it. And it brings important nutrients to those cells and tissues. It hydrates them. And it also, as it sort of flushes through that tissue, it will drag along with it dead cells, cancerous cells, and bacteria. But when at this stage of the game, it's no longer blood, it's called lymph. And you've seen this on yourself. If you had a mosquito bite and you've scratched it, maybe you've squeezed it, it will have like a clear yellowish appearance, more like a clear, slightly yellow appearance. That's lymph. And then after it perfuses through the tissue, it collects back into the lymph system and will meet at nexus called these lymph nodes. So lymph nodes contain lymphocytes, which are, you know, part of our immune system. And sometimes, not always, but sometimes if there's an infection in the body, you'll get these lymph nodes swelling. So that's why when your pet is at the vet, you'll see that vet feeling in these 3 areas indicated to see if those lymph nodes feel pronounced. Even when they're healthy, you will be able to feel them. You can try to go ahead and see if you can feel them on the places indicated on this diagram. This is pretty spot on. The best place I think you're going to have a chance of feeling them is at the back of the knee. So try feeling around back there. They feel like kind of like a flat pea or flat squishy bean. And if you can't, it's perfectly normal if you won't be able to feel them. Next time your pet's at the vet, ask your vet to point them out to you. I want to talk about weight and abdomen. We want to talk first about healthy weight for your pet. You don't want to have your pet to be obese. I know you want to show your love with food, but there's so many secondary issues that pets get with being obese. So make sure that your pet, if you're looking at your pet from above, has an hourglass shape. The chest should be round, it should taper at the groin area, and then it should expand again at the hips. If we're looking at your pet from the side, the lowest part of your pet's belly should be the chest, and then it should scoop up. So in your pet's body, you've got your heart, your lungs, and the stomach in that chest cavity, pretty much. And then all of this part of this tucked up is pretty much all small intestine. And that should be tucked up into your pet. So you should not see a lot of fat or anything like that there. You can do the hand test. So rub your hands on the side of your pet's chest. If you do, it should feel like the back of your hand. So you should be able to feel the ribs, but it should feel like it's covered with a comfortable amount of skin and flesh. The ribs should not feel as pronounced as your knuckles feel. And it shouldn't feel like the palm of your hand where you can't feel any ribs at all. You may want to just go ahead and feel that narrow part of your pet's body in the small intestine part. So we can we can cup our hand underneath the pet's belly and give it a squeeze on either side. Or if you've got a big dog, just feel on either side. It's as though you're trying to feel past the sides of a purse to figure out what might be on the inside. It should have a doughy feel. There should not be a lot of excessive gurgling. When you do this to your pet should probably be like, what are you doing? But it shouldn't react in pain in any way. And you don't want to see a sudden onset of bloat or have a bloat or have it feel hard or fluid filled. That would be a now visit to the vet. I want to bring up the rear of the pet. It's amazing how many times people will bring in their pet for an examination, and if they would have just lifted up the tail, they would have known what was wrong all along. So you typically don't have this problem with cats because they're walking around with their tail erect so often, but dogs, especially with longer hair dogs, you may see this issue. So first of all, take note of the tail position. The tail is a very important part of your dog or your cat's anatomy, and it often can be reflective of pain. So if there is pain in the animal's spine, or mostly at the spine, you'll see it reflected in the tail, the positioning of the tail. Make sure this rear area is clean. Make sure there's no swelling back here, licking or scooting. I put these arrows here so that you could see where your pet's anal glands, this is true for both a cat or dog, where they're located. Typically, you're never going to have any issues with cats, but sometimes dogs fail to express their anal glands as they should. Anal glands should express every time the pet passes a stool. It's the species way of sort of marking, of sending out a pheromone and chemical signal to the other members of its species about all sorts of things about what's going on in their body and their lives and their sexual cycle. However, sometimes their stools are not firm enough to apply enough pressure to make them express, or sometimes that's just the breed of your dog, but they should be expressing all by themselves. One trick, if you feel like your pet needs to have its anal glands expressed more often than not, is to add a little fiber to your pet's diet. So a canned pumpkin is an excellent source of fiber. It's typically sweet. You can mix this 1 or 2 tablespoons of this into your pet, if your medium-sized dog's food, they'll love it, and it will help bulk up those stools and express those anal glands. You can go ahead and feel them if you want. Put on a rubber glove. Make sure you lubricate the digit of your finger with a little KY jelly or Vaseline, and you can insert it into the rectum. You'll feel them just inside there. You'll have to use your thumb on the outside and your finger, but if you feel it, you'll feel it moving, squishing underneath your index and thumb, and it will feel like, depending upon your dog, again, like a bean or a pea. If it needs expressed, it'll be fatter and harder. If it doesn't need to express, it'll be flaccid and feel like a flat, empty bean. Oh, I need to teach you how to take temperature, respiration, and heart rate. So get yourself a baby thermometer, get one with a flexible tip so it doesn't hurt, and you want a rapid read one. I put the QR code there if you want to take a look at the ones that I mean on Amazon, which are described in more detail. Get yourself some KY jelly or Vaseline, lubricate the tip, and insert it in about 1 inch into your pet's butt. The normal temperature should be 100.5 to 102.5 for both dogs and cats. It may be normal for your pet to run a little higher, but anything over 103 would be concerned. And anything less than 100.5, I think that's a problem. So typically you don't see pets that run low temp normally. So especially with cats or sick dogs or sick puppies, a low temperature would be get thee to a vet now. I want to teach you how to do the heart rate. So stand behind your pet, cup of your pet's chest in your hand, and you'll feel a lub-dub, 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 lub-dub. If you want to match that lub-dub with the pulse, you can feel the femoral artery. The femoral artery is located just inside the thigh. It's one of the easiest pulses to feel. If you don't know where to feel, you'll be able to look on the inside of your dog or cat's thigh, and you'll see a blue vein. That's called the medial saphenous vein, and the femoral artery is typically beneath that. You can't see it, but you'll be able to feel it. When you feel that lub-dub, 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 the lub and the pulse on the femoral artery should sync up. Interestingly, dogs do not have a rhythmic heart rate. Their heart rate, when you feel it, will be like lub-dub, 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 lub-dub. That's called a normal respiratory sinus arrhythmia. It's normal for dogs. Cats and people, on the other hand, have normal rhythmic heart rates. So that would be abnormal if you felt that in a cat. The normal heart rate for a dog or cat, for that matter, is 60 to 120 beats per minute. Typically, the larger breed animals will have a slower heart rate, and the smaller breed animals or young kittens and puppies will have much faster heart rates. You are counting the number of lub dubs in a 15-second increment and multiplying it by 4, and that is your pet's heart rate per minute. And let's talk about the respiration rate. When you watch your pet inspire and expire, it should not be labored. So it shouldn't be like, or it shouldn't do that. Typically, pets that are in respiratory distress can't lay laterally, we call it laterally recumbent, because they feel like they're going to drown. They have to stay erect, and you'll see them with a strange neck position because they're struggling to breathe. That is a now visit. When you're watching your pet respire, you're watching the numbers of inspirations and expirations. You're multiplying it by 4, and that's your pet's respiration rates. Dogs and cats have 15 to 30 breaths per minute. I want to talk about skin and coat. As I said before, the skin is the largest organ on your body, and it's reflective of, you know, at the very minimum, what's going down with the skin, and on a much larger level, what could be happening systemically with a dog. It's remarkable how many illnesses that you can detect early on by just changes in the coat, many of which are, if not curable, they're easy to treat, provided they haven't progressed, and your pets can live with them for a long time. But it's important for us to identify. So it's really important to keep an eye on your pet's coat and make sure that we know that we're alerted of any changes. So look for redness or licking at the belly, paws, between the toes, and ears. This is very common for allergy-prone dogs and cats. About 30 to 35% of dogs and cats do have allergies. You should report any kind of pustules, lumps, excessive scaling, or dandruff. Sometimes it's normal to see dandruff on, like, you know, cats, for example. Like if it's a dark-haired cat, it's oftentimes we'll see dandruff. But just get to know what your pet's normal level of dandruff looks like, because excessive drying of the skin could be indicative of a number of serious medical illnesses, all of which can be treated typically, but we need to be alerted that they can't be allowed to get out of hand. Excessive itching is not normal. Many people will call us up, they'll say, my pet has fleas. Why do you say that? Because he's itching a lot. It's almost never fleas. It's almost always some sort of allergy. So you can test for fleas by running a flea comb through your pet's fur. You're going to collect that fur. And if you see anything that looks like small pepper flakes, take some of those pepper flakes and smear them on a wet paper towel. If they smear a rust color, that's typically a sign of fleas. That's called flea dirt. And the reason it's gross, but the reason that it smears a rust color is because it's dried blood. They're pooping out your pet's dried blood. That's what that flea dirt is. It's flea poop. It's not normal to see fleas on your dog or cat. So if you are seeing fleas or dogs and cats, that's typically indicative of a severe infestation. If you have a flea infestation, please at least call your vet and ask for help. Most of the infection lives in the environment, not on your pet. Fleas are jumping on your pet, feeding, and then jumping off again and laying eggs in the environment. So if we're just treating only to kill fleas, you're not managing that ongoing infection that's living in your environment. And as I said before, the coat should be soft, shiny, and lackluster coats are often, you know, hair loss, all that stuff is not normal. So here I want to wrap it up with, I hope I'm not going over. Oh, I might. Give me one extra minute and I promise I'll be done. So I want to talk to you briefly about the important services that you may have been told that your pet needs, and I want to make a case for their value. It is especially important that cats have annual visits at the vet. I know you don't want to bring your cat to the vet because it is afraid, and I feel you. And you know what? A lot of veterinary professionals feel the same way. They don't want to bring their cat to the vet. And if they do, they're typically giving it special treatment. There are lots of vets now that are certified as fear-free, and they've been trained how to make the cat or dog experience as anxiety-free as they possibly can. Cats are excellent at masking illness, and typically by the time they're showing signs of illness, it requires a more invasive approach to care and can be more costly and more uncomfortable for your pet. So please, annual visits for cats, especially any cat that's 8 or older, is important. If your veterinarian is offering you a chance to get an adult wellness screen or a senior wellness screen, you should take them up on it. even if your pet's only 3 or 4, it's a great idea to get the adult screen so that we have a baseline moving forward. That way, if your pet does have sickness later on in life, we'll have a normal to compare it to. If the blood tests are normal, well, that's great. You don't have to worry about them finding anything for the test to be worthwhile. We don't want to find anything. We're trying to detect disease early on. So if we don't see anything, it looks like we won, right? If your pet does well at the first adult annual screen, it's probably okay to skip it the following year. But once they become a senior, because dogs and cats age so rapidly, it's a good thing to have these done every year. All dogs and cats should be on year-round parasite control. If you are living in a part of the United States that has a high burden of ticks, well, that's kind of anywhere now, like the eastern seaboard, almost all the northern part of the country. It's only like the southern part of California and some of the southwest states where it's not so much of an issue. But we are seeing a tremendous, no pun intended, uptick in tick-borne diseases. It's not uncommon, and I'm being hysterical here, it's not uncommon for 1 in 6 pets to have some kind of tick-borne disease. So please get your pet on a year-round flea tick preventative. They're chewable, pets love them, and it's a great way to keep them protected. And finally, keep your pet's teeth clean. It is not normal for your pet's breath to smell. You may be at a stage of your life where you're pushing your pet away because you can't stand that breath. And that's no good. That's not good for your relationship with your pet. And your pet doesn't really get it either. Doesn't get why you're not as kind and sweet to it as you once were. So we talked about, I promise I'm wrapping it up here. We talked about how capillaries, once the blood is in the capillaries, some parts of that blood perfuse through, that serum perfuses through into the tissues. Well, in your dog's mouth, when they start getting those red gums and gingivitis and infection, some of that bacteria is leaching into your pet's tissues. And the lymph system is draining all of that crud out and into the lymph system, and it's causing a low-grade inflammation and a punky feel for your pet. And you mark my words, if your pet has moderate to severe dental disease, you take that pet to the vet and have his or her teeth cleaned, I promise you're going to see a change in attitude in that pet because you've gotten rid of that infection, and your pet will feel much better. And even people that come to your home will be like, what's up with your pet? So much happier, so much more active. That really makes a difference. So thank you so much for spending time with me today. Again, pardon me, there is the QR code so that you can have another swipe at scanning it. I wanted to put up a couple of the specials that CC has available to you so you can take a look at, and then we'll open it up to any questions. But gosh, thank you so much for your attention and sitting through that whirlwind of information. I know that was a lot.